Hello, my name is Jennifer Scroggie, and I'm faculty in the School of Nursing here at Vanderbilt in the Psychiatric Nursing program. My nursing journey began about 40 years ago in Australia, and I moved to the US in 1990. I was lucky enough to be able to take my nursing degree over again at Belmont, and then graduated from Vanderbilt in this program in 1998. I'm also a trained psychoanalyst, and I graduated from the St. Louis Psychoanalytic Institute in 2014. I've also done some training in Gestalt psychotherapy. So you can imagine that my primary area of interest is psychotherapy. I've been teaching here in the School of Nursing for the past 18 years, primarily in the graduate year, but now a little in the pre-specialty year in the clinical groups. My focus, again, as I said, is on the theories of psychotherapy. I teach that course with Dr. Sinclair. I also work in the clinical series course, and my focus is on psychodynamic psychotherapy. Primarily, my interest is in all aspects of the relationship between the provider and the patient. I've also been in clinical practice all of my career, and so I began a long time ago in Australia as a home care and hospice nurse, and that led me to oncology, which led me to realize that I'm much better as a teacher and as a therapist than as someone who takes blood pressures. I've had a joint teaching role and clinical practice in the School of Nursing and in the Department of Psychiatry as an assistant professor. And so I taught worked at the Villages of Vanderbilt in outpatient private practice, focusing on mood disorders, trauma, and personality disorders. I prescribe and do both psychotherapy as well. Currently, I am still in full-time teaching, but also in private practice, not far here from Vanderbilt. And I'm a faculty as well in the Advanced Psychodynamic Psychotherapy program, which I teach in. I'm also involved in the Nashville Psychotherapy Study Group, and all students are always welcome to that when you begin in the program. I've presented lectures at APNA, and I'm a member of ANA, TNA, and the Psychiatric Nursing Association organization. I believe our program offers a really unique opportunity in that we have a very close mentorship and connection with the students. So for 20 years now, every year I have 2, 3, or 4 students that I track every single week in supervision, group and individually. And I think this makes us special because students know that I'm very aware of what's going on. I'm able to connect with them and make sure that they're getting the resources they need if things go awry. I think also we have a very excellent range of faculty who have clinical and academic competence in many different areas. So it's been wonderful speaking to you, and welcome.